In this video, we'll discuss about sample collection and transportation. Without any universal precaution, we don't go for any other work, mostly in hospital. So first we want to know universal precaution. What are the universal precaution you should take while collecting sample? First one is use barrier production. While collecting sample, use barrier production. Cover any open wound before processing. So we must cover any open wound before collecting samples. Then wear gloves. While handling body fluid or contaminated material or other waste, we must wear gloves. Third one is wear a face mask or gown. Without wear any face mask or gown, you never take any samples. Then we should follow use cautions because while handling sharp object like needle, syringe, or some other things, we should take some caution. We want to avoid that needle trick injury. So use caution when handling sharp object, needles and waste. Then discard contaminated material. Follow biohazard procedures for disposal. So next discarded contaminated material. Follow biohazard procedure for disposal. Clean area thoroughly with disinfectant. Then wash our hands thoroughly by using soap and water at least 20 seconds. Then wash our cloth by using hot water, not normal or cool water, um, hot water. Wash cloth by using hot water. Next, before collecting sample, labeling is important. Without proper labeling, don't send any sample to microbiology department. Coming to labeling, patient name, the container should have patient name, what type of clinical specimen, whether it may be blood sample, urine sample or pus sample, then site where taken that sample, whether left hand side, right hand side, like that. Then each and every hospital patient having unique id number. Id number is important. Then what type of specimen we want to collect, then it containing date, time and place of collection. Then name and initial of collector and ward, which ward, whether operation theater or ICU. So before collecting samples, that labeling is important one. These are the things containing patient name, clinical specimen, site, id number, specimen type, date, time and place of collection, and name and initial of collector and word. Coming to requisition form. Requisition form is important. Based on the patient clinical history only, we have to give accurate report. Okay, so that reason that requisition form is very important one. Based on the patient clinical history only, we have give accurate report. In this form we will fill all the information. Okay, we should fill all the information, what text we want to perform. These are the some important things for registration form. Patient history should be important. Sign of consultant, then sign of sample collector, date, time, patient name, patient id number, age and sex, ward and sample site, then test request, what type they will do. All the things mentioned in this registration form. Registration form is an important one. We should fill all the information. A patient history is the important one. sign of consultant, then sign of sample collector, date, patient name, id, age, sex, ward, samples, which site we want to collect, then test request. Next, these are the some criteria for rejecting samples. What are the criteria? Mismatch of information on the label and the request. So this one is the important one. Mismatch information. Sometimes the requestation form is different patient, sample labeling is the different one. This sample we should reject. Then inappropriate transport temperature, say for example some sample it required 4 degrees Celsius, some samples it required room temperature, so inappropriate transport temperature is required. Then excessive delay in transport, within 2 hours all the samples we transported to laboratory, excessive means we reject. Then inappropriate transport medium we can use. For during sample collection, proper transport medium we can use specimen received in a fixative or a dry specimen or sample with questionable relevance. Then insufficient quantity, say for example urine sample we required 5 ml, it containing only 1 ml means we must reject. Then leakage, then without request form, these are the criteria we must. Next, sample collection. How to collect sample, how to preserve. First one is abscess. Abscess means it should be lesions, wound, pustules or ulcer. So abscess, it may be lesions or wound or pustules or ulcer. It should be two types, aerobic and anaerobic. Aerobic means we want to collect superficial, anaerobic means deep lesions. Collecting samples should be wiped with sterile saline 70% alcohol in the infected area, then swab along the leading edge of the wound. So we swab along the leading edge of the wound. Then transport after collecting, that's transport less than 2 hours and 2 swabs are recommended. More than 2 hours or 1 swab are rejected. In case of only 1 swab, immediately call microbiologist, explain the condition of that patient, then only accept. Explain the condition of that patient, then only accept single swab. Otherwise, we must collect 2 swab. Pus can be aspirated by using syringes only. In case of closed space abscess, first sterilized by using saline or alcohol, then insert needle and aspirate sufficient amount of pus, then transport to microbiology department. In the case of open wound, remove that superficial exudates, aspirate through margin or swab. Next samples, blood sample. In microbiology lab, blood mostly using for culture only. Otherwise, we can use it for serological, that antigen antibody reaction. So, blood culturing and serological reaction. Blood culture. Now coming to blood culture, 3 type of bottles is available: aerobic bottle, anaerobic bottle, and pediatric. Based on the requirement, we can purchase aerobic or anaerobic and pediatric. In case of infant means we want to collect 0.5 to 2 ml of blood. Children 2 to 5 ml. Adult means 5 to 10 ml. So we want to collect blood infant 0.5 to 2 ml, children 2 to 5 ml, adult 5 to 10 ml. Blood should be taken vein puncture only. On the preparation of vein puncture, first to locate skin. Then by using alcohol, clean 5 minutes, then dry for 30 to 60 seconds. Take tincture of iodine, center to periphery, then try 45 to 60 seconds. Without palpating, draw 20 ml. In this 20 ml, put 10 ml in aerobic and 10 ml for anaerobic. So 10 ml aerobic and 10 ml for anaerobic. Label bottle and send to laboratory. Three type of blood culture bottle: aerobic, anaerobic and pediatric. Infant 0.5 to 2 ml, children 2 to 5 ml, adult 5 to 10 ml. Vein puncture only. First, collecting area clean with alcohol, then take tincture of iodine, center to periphery, try 45 to 60 seconds. Then based on the health condition, patient healthy means 20 ml, otherwise 5 ml is enough. Next, body fluids. Various body fluids is there. Here we are mentioning amniotic, synovial, pericardial, pleural and CSF. First apply disinfectant 70% alcohol, then insert needle aspirator. Immediately transferred into a sterile cap tube or direct inoculation into blood culture bottle. Then label it proper and transport within 15 minutes after aspirate. Various body fluid we want to collect first by using 70% alcohol. We want to clean, then insert needle, then collect samples into a blood culture bottle, immediately transferred to laboratory. Next, urine sample collection. For urine, three method we are using: clean catch or midstream urine, catheterized urine, then supraphobic aspiration method. This clean catch and midstream urine most commonly used method. First, we want to discuss clean catch. We will give instruction to our patient. It is very important. Clean periurethral area by using soap and water. Pass initial urine into the toilet, then collect midstream. Mid urine only we want to collect in a sterile cup. Before collecting, label the container properly. Incorrect or not labeling container should be rejected. So first clean catch, this one most predominantly used method. We want to give instruction to our patient. Clean periurethral area by using soap and water. Then we want to initially pass few urine, midstream urine only we want to collect. If we find more than 3 or 4 different type of bacteria, it must be contaminated. We want to take one more time, repeat that sample. Second method, catheterized urine. This one, clean periurethral area with soap and water, allow to dry and wipe with 70% alcohol. Then insert a catheter into bladder, discard initial urine and collect the specimen in sterile cup. Chronic indwelling catheter. Second method, chronic indwelling catheter method. Here collect the sample in between junction. Catheter collect junction between catheter and a collecting tube, not in this discarding jar, because this one is the 24-hour urine chances for contamination. So catheter urine two form. One is insert catheter into bladder, we want to collect. Second one is chronic indwelling catheter, in between junction we want to collect that urine sample. Third one is supraphobic aspiration method, indicated. This one is sudden clinical condition. Some underlined condition collect samples and they unable to pass urine. So here follow full aseptic technique. This one little bit risky only for premature infant, small children and a pregnant woman. Bladder must be full. Okay, here condition bladder must be full before performing the procedure. Prepare the skin with alcohol or iodine, then here give some lidocaine. Here we want to give some lidocaine. Insert needle 2 centimeter, yeah, 2 centimeter, then we will collect, then send to laboratory. So 20 ml of urine we can collect and send to laboratory. So supraphobic aspiration method, this one some underlined condition we collect that sample. Here we can follow aseptic technique, a little bit risky because of infant, premature infant. When bladder full, then only we collected the sample. Before that we should give some lidocaine, then insert needle 2 centimeter, then collect and send to laboratory. Next, stool. First, alimentary canal normal flora we want known first, then only give report. Alimentary canal normal flora we want to known first, then only will give report. In this one, freshly passed stool sample only we can use. Avoid specimen from a pet pan. Then use sterile or clean container. That container don't clean with the disinfectant. Then during an outbreak means we collect sample from 10 to 20 patient. During outbreak collect from 10 to 20 patient. Freshly passed stool only required, not recommended pet pan stool samples. Clean container, don't clean with disinfectant. Then outbreak time 10 to 20 patient sample should collect. Now coming to collection, clean leak proof container only we can use. Transport within half an hour. If delay means we can use transport medium, carry layer medium. That volume of stool 1 teaspoon. In the case of liquid formed stool means pea-sized pieces is recommended. Leak proof clean container within 30 minutes we can transport. In the case of delay means we can use carry layer medium. In the case of direct wet mount examination, Clostridium difficile taxane, detection of virus, ELISA technique and lactose agglutination, no need for preservatives or fixative stool sample. Freshly collected stool only recommended for this kind of test. Next, bacterial culture. If doctor is asked, then only we want to do Salmonella, Shigella, Campylobacter, Vibrio, Euromonas, Yersinia, E. coli 0157H7 strains. If needed, Zika taxine assay we can do. These are the things CDC recommended. In stool parasite, stools mixed with 10% formalin or polyvinyl chlorine. 3 part stool, 1 part preservatives. 3 part stool, 1 part 10% formalin or polyvinyl chlorine. unpreserved sample for antigen detection and PCR. So parasite detection we are using this one, unpreserved sample used for antigen detection and PCR. In the case of rectal swab, sample collection, insert swab approximately 2.5 centimeter anal sphincter. Species should be visible on the swab. So here insert swab 2.5 centimeter anal sphincter. Feces should be visible on the swab. Transport immediately without delay. If delay, use transport medium. Advantage, this one is the convenient method. Drawback, not recommended for virus, used for bacteria identification. Then gastric aspirate, diagnosis for tuberculosis. Many young people have difficulty in explorating sputum. Gastric aspirate are frequently required to culture the organism in a pediatric patient. When children with pneumonia sleep, their mucociliary mechanism sweep that mucus up their airway into their throat. They swallow that mucus, and unless the stomach empties, a proof of mucus in stomach may be source of TB organ. So stomach may be source of tuberculosis organism. During sleeping time, it will reach to stomach. Instruction: early morning gastric aspirate sample we must collect. Should inform patient they sleep at least 6 hours without interruptions. Then they should not eat or drink anything overnight to prevent the stomach from emptying. Collection: use nasogastric tube. Large tube we want to use 2 set of samples. Then transfer 5 to 10 ml gastric fluid from syringes into sterile container and add equal volume of sodium bicarbonate solution. Why we are adding sodium bicarbonate means this gastric fluid highly acidic, so we want to do neutralize, that reason only we are adding sodium bicarbonate solution. Then a sputum sample, two type of sputum. First one is export sputum sample, two type of sputum. Exported sputum, it will contaminate with upper respiratory tract secretion, saliva. Need invasive technique. Collection: food should not injected at least 1 or 2 hours. Mouth should be washed with saline water. Then should instruct to provide tea cough and sputum directly into wide mouth sterile container. Minimize or avoid saliva contamination. Acceptance or rejections: more than 10 squamous epithelial cell per low power field. In microscopy, more than 10 squamous epithelial cell means we want to reject. In the case of more than 25 polymarbonuclear cells together with few epithelial cell, 5 to 6 cells means that one is the excellent samples. If rejected, advise patient to send a repeat sample. Then second method, induced sputum. Patient unable to produce sputum with the help of respiratory therapist by using thoracic pre-suctions to induce sputum. Before collecting, patient should brush the buccal mucosa, tongue and gums. The patient inhale nebulized hypertonic saline solution which liquefy airway secretion, promote coughing and allow expectorations of respiratory secretion. Contraindication as hypertonic saline causes bronchoconstriction. The procedure should only be performed after free medication with salbutamol. Okay, be performed before after free medication with salbutamol under medical supervision in patient with asthma or suspected asthma or severely impaired lung function. Last one is ED secretion. Sometimes it will enter lungs, causes pneumonia during aspiration. In this video, discussed sample collection and transportation. Before we discussed the universal precaution method. This is the most format. Labeling. The second one is requisition form. Both are important. Criteria for rejecting samples. Then sample collection. Thanks for watching.